Welcome to Mayfaire. I'm sorry I couldn't be there tonight, but prior commitments took me out of town for the weekend. I hope you enjoy this special evening for a very, very good cause for the Benefis Healthcare Foundation. Bree, I know you and your family are there tonight. I hope you have fun. I know you will. For those of you who don't know Bree, you'll learn more about her as the night goes on. And I hope you get a chance to meet this very special young girl. She's been an important part of my life, and she's a pleasure to be around. And those of you who meet her will find that out very quickly. Gabrielle had a number of congenital anomalies, the most prominent of which was what's called an encephalocele. And so she was born with this large lump on her forehead consisting of spinal fluid and a little bit of abnormal brain tissue. Along with that, she had some craniofacial abnormalities. Her left eye was missing. She had what's called an amniotic band around her arm. So she was born with her arm amputated above the elbow. None of these abnormalities that she had at birth were immediately life-threatening, so we let her go home for a month, and her first surgery involved repair of this encephalocele, which was a relatively difficult procedure. Shortly after that surgery, we put in her first ventriculoperitoneal shunt, and that's a procedure to drain the spinal fluid down into the belly because her brain was not absorbing the spinal fluid normally. So that was her first two surgeries. Bree's condition was really quite complicated at birth. And in years past, we may have elected to send her to a children's hospital for some of these surgical treatments and especially the initial repair. When we have a perinatologist such as Dr. Key here, and then we have an outstanding neonatal intensive care unit, and then we have very good pediatric services. In many circumstances, families who would have to travel to Seattle or Salt Lake and maybe spend weeks or sometimes even longer than that away from their homes, we can take care of those patients here. And that's why this is such a good thing to support this program so that we can maintain and grow these capabilities so that we can take care of more of these children here locally. Bree's had a ton of surgeries. I think she's keeping track, actually. None of the rest of us are. We've had to revise her shunt several times, and in fact, just this year we've revised her shunt, I believe, 3 times. She's had an artificial eye made for the left eye socket. Every surgery she has done very well with. She's an old pro at this now. Bree is an amazing little girl. You know, when she was born, her parents were extremely young, very young. Bree's mother has done an exceptional job, and she has terrific support system. The grandparents are always there. They have really raised her into just the most charming little girl. We look forward to the days that she comes into the office. If I look at the patient list for the day and Bree is on there, I know it's going to be a good day in the office. No matter what else happens, it's going to be a good day in the office. She's bright. She's doing well in school. She is active. She has a tremendous sense of humor. Anyone who meets her will immediately find out what a brilliant little girl she is. I think she's going to do well. Right now I've told her that within reason she can do virtually anything that she wants to. She should be a normal kid and do normal kid things. I think the sky's the limit for her. I wouldn't bet against her at all. The nurses and everyone else, even in my office, know Bree's tagline perfectly, and that was really funny. when she says that, we know everything's okay. Yeah, we'll see you next year when you're 10.
That's really funny.